A recent study has shown that the REGENETEN Bioinductive Implant can significantly reduce the risk of re-tear after rotator cuff surgery. Rotator cuff tears are common shoulder injuries, and even after surgery, there's a chance the tendon could tear again. However, this study found that using the REGENETEN implant during surgery lowers that risk considerably. In the study, 124 patients with medium to large rotator cuff tears were divided into two groups. One group received a standard rotator cuff repair, while the other group received the same repair but with the REGENETEN implant added. After 1 year, only 8.3% of the patients with the REGENETEN implant experienced a re-tear, compared to 25.8% in the group without it. This means the implant reduced the re-tear risk by about 68%. Importantly, there were no additional complications in the group that used the implant. The REGENETEN Bioinductive Implant is a small collagen-based patch placed over the repaired tendon during surgery. It supports the body's natural healing process by encouraging the growth of new tendon-like tissue. This helps strengthen the repair and reduces the chance of re-tear over time. Experts believe this implant could be a game-changer for patients undergoing rotator cuff surgery, offering a better chance of long-term success and recovery without increasing risks. Since its introduction in 2014, the REGENETEN implant has been used in over 100,000 surgeries worldwide. For patients facing rotator cuff repair surgery, the REGENETEN implant offers a promising option to improve healing and reduce the risk of repeat injuries, ultimately leading to better outcomes and a quicker return to daily activities.